Okay, hey you guys, I am back with another video on the life of a scrub tech. All right, so today I want to talk about patient expectations. I feel like there's about 10 things, about maybe 1 to 7 things we're gonna do tonight, okay? Because we're gonna make this quick. I got somewhere to go, but a few things that patients need to expect when they're having surgery and don't take for granted when it comes to having surgery, right? One thing is no eating, okay? When the doctor say don't eat before surgery, don't eat. Because you know what happens? You intubated, you go to sleep, you intubated, and you throw up. You aspirate. And sometimes you can die from aspiration because you want to take a bite of a nugget or some eggs, or you know what I'm saying, stuff that you can avoid. If the doctor say no eating, no eating. Please, please, please. It is for a very important reason, and we want everybody that comes to the OR to leave the OR, okay? Number 2, no jewelry. We have patients that come to the OR with nose rings, stomach rings, stuff that they say they can't get off. Okay, we use something that's called electrocautery. The electrocautery that we use to cut through your incision or whatever incision we getting ready to make to stop the bleeding, it runs currents through your body. So if you have any type of metal on, those areas get burned too. So we as experienced people in the OR, we know how to prevent you from doing that. We'll do some things like put band-aids on the wound or wherever the piercing is, but just go ahead and remove the jewelry so we won't have those issues when it comes to the OR. Or if later on you find out you got a burn somewhere and you trying to figure out how it got there, like, don't be trying to say the hospital did it. No, we told you. We give you instructions to prepare yourself for surgery. So we just want y'all to be safe. We want you to be healthy, and we want to fix your problem. So make sure, number 2, no jewelry. Number 3, be on time. Okay, we have not just you to operate on. Sometimes we have 4, 5, 6, 7, 8, 9, 15 cases in one day. So if you are scheduled to be there at a certain time, when you don't come at a certain time, you know what we doing? We sitting there waiting. We waiting and we wait. Or you get bumped down and now you have to wait even longer. And sometimes that could cause a lot of confusions, a lot of disruptions, and we don't want stuff like that. So we want y'all to be on time so we could get you in and we could get you home, okay? So number 3, be on time. Number 4, no long fingernails or color, right? The color on the nails, it messes with the pulse ox, monitoring your heart rate. So if you can, just try to, if you know you're getting ready to have surgery, if you want your nails done, you want to be cute, because clearly we always want to be cute, right? So just go ahead and polish your nails and make sure they are a little short, or at least that one finger. I mean, you get that one finger done over, okay? Just get that one finger clear so we can go ahead and put the pulse ox on. It can read accurately, okay? We don't need any misreads when it comes to your heart, your blood pressure, any of that, right? So we want to make sure that you are doing the necessary things to make sure everything is reading right. All right, that was number 4. Number 5, medicines. Okay, the medicine that you take, let us know everything you take, everything, because believe it or not, if you don't tell us that, the medicines are still, you might not have taken it the day of surgery, but if you was taking it 3, 4, 5 days before surgery and it's still in your system, and you come to surgery and we trying to figure out why this patient is bleeding so much, excuse me, y'all, why this patient is bleeding so much, or why, they're having reactions, or the blood pressure drop, or the blood pressure raised up too high, or their heart rate is getting really low, or you see what I'm saying? And if you leave out vital information about your medicine, then that can cause us to have a lot of complications in surgery, right? That we, as experts, we are trying our best to maneuver through because you left out vital information. So again, if you're on blood pressure medicine, please take your blood pressure medicine that morning. That's one pill you would take regardless, so you having surgery or not. Take that blood pressure medicine. And then we will monitor it during surgery, all right? So that was number 5. Number 6, be truthful. Do not lie to us. Please. I mean, look, we ain't about to take your job away. We ain't about to send you to jail. We ain't about to call them people. We just want to operate on you so we could get you out of there. So be truthful for us so we could get you off that table. Okay? All right. Number 6, have a way home. That is number 6. Don't y'all want to go home? I know y'all want to go home. Y'all don't want to sit in the operating room all day, right? Make sure y'all have a ride home, because the longer you are in PACU, them dollars are ticking. You hear me? You are gonna have a bill. We bill for surgery, right? We bill for the things that we use in surgery, and we bill for time in the OR. So just imagine if, anything, any delay, waiting on a doctor, we waiting on patients, to wake up from surgery because, hey, that patient didn't tell us that they was on such and such medicine. Nah, we can't wake them up right now. They sleep, they knocked out. That's time, that's money, right? So I need you guys to make sure that you are doing the necessary things. Just fulfill our expectations as a patient, right? So you could get in and you can get out. We want to see everyone. Most times the cases, I'm sorry to cut off, but some of the cases that we do are elective, right? And some are not elective. They are emergent cases. But that's why you have to be truthful to us so we can better serve you and take care of you. That is our job, is to make you better. So help us help you, right? All right, y'all. I just gave y'all a few little tips on expectations of the OR. Again, this your girl, Cajun Queen. And I want y'all to be safe. I'm going to come back with another one real soon. So, y'all have a great weekend. Thank you very much. I'm going to have me a great weekend. So I'll holler at y'all, all right? Okay, bye-bye.